There are 4 important vital signs. Heart rate, also called pulse rate, indicates the condition of the heart and the flow of blood in the body. Body temperature. An abnormality in the body temperature level indicates presence of an infection. Blood pressure, which indicates the flow of blood to the various organs of the body. Breathing rate, also called respiratory rate, which indicates the functioning of the lungs and the supply of oxygen in the body. To measure the vital signs, there are some basic equipment that you require. They are thermometer to measure the body temperature, stethoscope to measure the heart rate and the breathing rate, blood pressure meter, also called sphygmomanometer, to measure the blood pressure, and a watch to keep the time for each of the vital signs. Pulse rate is the number of heartbeats that are observed in 1 minute. Measuring the pulse can give an important indication about the patient's heart. Abnormal pulse rate, like very low pulse rate or very high pulse rate, is considered to be a medical emergency. For healthy adults, the pulse rate should be in the range of 60 to 100 beats per minute, with an average pulse rate at 72 beats per minute. The pulse rate is in the lower range for resting individuals and in the higher range for exercising individuals. Pulse can be measured at many places of the body, such as wrist, also called radial pulse, neck, inside the elbow, behind the knees, and near the ankle. The radial pulse rate is the quickest and accurate measure to understand the pulse rate. First, prepare the patient to rest. If the resting heart rate must be taken, ensure that the patient has been resting for at least 10 minutes. Ask the patient to stretch his hand. Place your index and middle fingers over the patient's wrist. Make sure your fingers are flat. Finally, press against the wrist until you feel the pulse. Once you find the pulse, count the beats for 1 full minute using a watch. The number of beats counted is the radial pulse rate of the individual. If the pulse rate is found to be abnormal, repeat the process and measure the pulse rate again. If the rate remains abnormal, Report the same to the attending nurse or the doctor immediately.